At a microscopic level, GLP-1 medications physically rewire the complex biological signals traveling between your gut and your brain. The story starts in the 1980s, far away from any pharmacy, deep in the desert. Scientists were studying the Gila monster, a chunky lizard that eats rarely. In its venom, they found a fascinating chemical. This chemical looked incredibly similar to a hormone naturally produced in the human gut called GLP-1. Our bodies release this hormone to say, food has arrived, but it breaks down fast. The lizard's version survived in the bloodstream for hours. These medications dock into cellular receptors that bridge your digestive system and your brain. By occupying these sites, the drug regulates how quickly you process food and how soon you feel full. By tapping directly into biological systems that evolved over millions of years to keep us alive, these medicines are completely rewriting the rules for how we treat diabetes and metabolic disease. The results we are seeing in patients are massive. Many people on the newer versions of these medications lose 15 to 22% of their total body weight. On top of that, major studies show a 20% drop in the risk of heart attacks. But those numbers demand a steep price. Achieving that massive weight loss usually requires navigating severe gastrointestinal distress, fighting off rapid muscle degradation, and paying a premium financial cost. This chart plots your options. Standard diet and exercise sit down here. Low cost, but often low impact. GLP-1s live way up here in the top right. Deciding to take them means entering an ROI equation, a biological subscription where you must weigh personal health risks against the drug's heavy physical toll. This animation shows exactly how the drug starts working. It applies the brakes to your digestive tract, drastically slowing down gastric emptying. Food stays in your stomach far longer than normal. Because your stomach stays full, the medication sends a continuous signal up to your brain. That constant hum of food noise and cravings completely quiets down. You feel entirely satisfied after just a few bites. But forcefully holding food in your stomach creates a backlog. This artificial delay is exactly what ends up triggering severe nausea, vomiting, heartburn, and constipation in so many users. To keep your body from rejecting the medication entirely, doctors have to start you on a tiny dose. Over several months, they slowly increase the strength, forcing your system to build tolerance to the side effects. At the exact same time, the drug is communicating with your pancreas. It prompts the release of insulin precisely when sugar enters your blood, keeping your energy levels incredibly stable. Getting to a place where you finally have mental peace from food cravings means you have to survive a demanding, often deeply uncomfortable adjustment period for your entire gut. With your appetite heavily suppressed, your body takes in significantly less food. You enter an extreme caloric deficit almost automatically. The scale drops fast, joint stress rapidly decreases, and fatty liver disease reverses. This line graph tracks total body weight over a year on the medication, but look at the splint underneath. You are losing fat, but a major chunk of that drop is actually your vital muscle mass and bone density vanishing alongside it. If that muscle loss continues unchecked, it leaves you physically frail. It is also the reason people experience facial hollowing, sometimes called Ozempic face, as the structural tissues under the skin simply disappear. To prevent this, you have to actively fight back. Patients on these drugs must meticulously track their daily protein intake and commit to heavy strength training to protect their bodies. Dropping 3 pant sizes is only a true health victory if you can maintain the structural muscle mass required to actually live an active life. Beyond the physical toll, there is the financial reality. You are signing up for weekly injections or a regimen of modern daily oral pills. Without highly comprehensive health insurance, the out-of-pocket cost for these medications frequently breaks past $1,000 every single month. That massive investment buys you remarkably sustained blood sugar control, dramatically lower systemic inflammation, and a reliably lighter body. Because these drugs act as ongoing hormone replacement, their effects require the medication's constant presence. If treatment stops, the weight almost universally returns. The mechanics are simple. The moment the artificial hormone clears your bloodstream, the quiet in your mind breaks. The ravenous appetite and food cravings return at full strength. Choosing a GLP-1 initiates a long-term biological and financial commitment. Let's map this all out. This decision tree helps weigh your personal health baseline against the true costs of the drug. First, we have the high clinical need group. This is for individuals managing type 2 diabetes, severe clinical obesity, or high cardiovascular disease risk. For this group, the equation is clear. The gastrointestinal distress and financial costs are heavily outweighed by the life-saving benefits of preventing a heart attack or stroke. Then there is the middle path. These are individuals looking to lose 20 or 30 pounds who have the disposable income to easily afford the monthly price tag. Here, the investment only makes sense if you are fully committed to protecting your muscle mass through rigid exercise, and you accept the likelihood of paying for a maintenance dose indefinitely. If you have true metabolic dysfunction, or you possess the immense financial resources and discipline to handle the side effects, the GLP-1 equation works in your favor. But there is a group that fails this equation completely. These are people looking for a quick summer shred or a temporary cosmetic fix. Trading thousands of dollars and months of nausea for a short-term weight loss that will immediately return the second you stop the shots is a terrible biological investment. And clinically, anyone with a personal or family history of specific thyroid cancers or pancreatitis must strictly avoid these medications entirely. GLP-1 medications represent a significant leap in metabolic science. Their effectiveness relies on viewing them as serious, lifelong medical interventions rather than casual consumer trends.